Okay, we're going to go ahead and get started. Good morning, everybody, and welcome to Social Security, Understanding the Benefits. I am Emily Grosinger. I'm the office manager here at ElderWorks. And just a reminder, we are recording this presentation and we are currently live on Facebook. And we'll also be posting this to the ElderWorks YouTube channel as well. So you're always welcome to go back and review the presentation or share it with your friends. Before we begin, I'd like to explain a little bit about ElderWorks. We are a not-for-profit 501c3 organization, and our mission is to provide older adults, seniors, and families with information, referrals, and guidance for senior living, home care, and support services. This includes education on senior topics for community members and also professionals. The guidance that we provide will help seniors stay home well or transition successfully into a new senior housing opportunity. If you do have questions throughout the presentation, Megan will be addressing those as we go. And you can save them up for the end too, if you would like to do that as well. And after our webinar, we do have a short survey that should pop up on your screen. If you don't see it, you will also get an email with the link to the survey tomorrow as well. We would appreciate any feedback that you have. So I will go ahead and introduce Megan Forristall. She's the Public Affairs Specialist from the Social Security Administration. Thank you, Megan.
Emily, thanks for having me. Looking forward to presenting some valuable information today. Just to start off, I am working remotely and I have a puppy coworker at home. So if I disappear at all, it is to bribe her if she starts making noise. So I just wanted to let you know that in advance. I have been working with the agency for going on 17 years now. I'm actually based in Peru, Illinois, but as a public affairs specialist, I cover a 17 office area in Illinois, including a majority of the suburbs, basically north of Joliet, that I cover in my servicing area. So today, what we're going to do is just a wide variety overview of our programs. If you have questions, I think Emily's going to try to keep a little eye on the chat for me, but I'll also be addressing them at the end. It could come up that your question is one that I'll end up answering throughout the course of the presentation, and we'll take time for those at the end too. So just to start off with some basics on Social Security, as far as how you come about drawing a Social Security check, well, of course, most of us see those FICA taxes coming out of our paychecks as we work. You know, we see them on our W-2s when we file taxes every year. That FICA or Social Security OASDI tax is what you're working and paying into the Social Security system on. So these taxes help fund Social Security, retirement, disability, survivor, and healthcare insurance. About 178 million workers are paying taxes this year in 2022. So that's about 40% of workers, 94% of workers being covered by Social Security. So one thing in Illinois we do see is we do have a portion of people not paying into Social Security tax. That is mostly our public school teachers, public university employees, things like that, who actually pay into a separate Social Security system. But the great majority of workers in the United States do pay into Social Security. One moment, please. Sorry about that. We'll see how long our bribe lasts here. So first program we're going to talk about is Social Security disability and supplemental security income. These are our two programs that Social Security administers based on a medical condition preventing an individual from working. We have, as I said, two different programs based on these medical conditions. The first is Social Security disability insurance. This is the one you work and pay into with those FICA taxes. Now, our medical definition of disability is the same for both of these programs we're going to discuss, but the rules of entitlement are different. So for Social Security disability, the medical definition for this and SSI, which we're going to talk about, is having a medical condition preventing substantial work for at least 12 months or expected to result in death, such as a terminal illness. Now, we don't need you to already have been out of work for at least 12 months to apply for these benefits. It's just that the expectation is that disability is longer term. And for Social Security disability, you must be found disabled at least 6 months prior to your full retirement age, and you need to be working and earning less than substantial gainful activity. Now, this is a dollar figure that we deal with every year. This substantial gainful activity changes, but it's a dollar figure that you are not being able to expect it to work and make monthly. For Social Security disability, you have to have both recent work and an overall amount of work that you've paid into Social Security system with those FICA taxes. Depending on how old you are, depends on how much work you need in that system to be insured for disability. And as we go along with this presentation, you will see links oftentimes on the bottom of this PowerPoint. And I know Emily mentioned she'll try to make this available to you following the presentation if you've registered for the presentation. So you can always check out the references on these pages for more information about each of these programs. Just really important, always make sure you're using that .gov. Then for supplemental security income, again, the medical determination is the same for adults as anyway for supplemental security income, but SSI does not require that you have worked and paid FICA taxes to qualify for it. This is a needs-based program, a federal program for individuals with limited income and resources. So same quality criteria for adults with disabilities. It's also for children with disabilities. And then individuals over age 65 do not need a medical decision to qualify for SSI. It just looks at the income and resource criteria. So just a breakdown on the differences between the two programs. Social Security disability, again, you're working and paying into that trust fund, and the payment amount is based on how much you worked and paid into that system. And these benefits are available regardless of income and resources. So you can have $1 million in the bank, you can have multiple properties, multiple vehicles, and still qualify for Social Security disability because it's what you worked and paid in. And these benefits are for the worker that's worked and paid into the system. And for some adults disabled since childhood, which we'll talk about a little bit later on. And again, you have to meet that insured status requirement. Whereas SSI, this is completely separate fund from Treasury, not the Social Security Trust Fund. SSI payments are not based on earnings whatsoever. Sometimes individuals might qualify for both Social Security disability and SSI benefits depending on Social Security payment amount. Again, this is completely looking at income and resources. So that's really important to remember with this program. It is needs-based. We look at the individual filings, income and resources, as well as if they're married, their spouse living in, if they're living in the home with their spouse's income and resources. When we're looking at children, we're looking at their parents' income and resources, a parent living in the household in addition to that child's income and resources. So I will say SSI has a lot of different rules to it. So we have a lot of great information about SSI on our website, including some great spotlights. So if you're interested in more information, I definitely encourage you to check out socialsecurity.gov section on SSI. Okay, so check out. Okay, so I don't see any questions yet about disability. Again, we're going to go ahead and take some more questions at the end, but we're going to move on to discussing retirement benefits now. So to qualify for retirement, same as qualifying for disability, you're working and earning and making money toward paying Social Security taxes, and you're earning credits. So for retirement, it does not matter when you earn those credits. Whereas disability, we talked about, you need recent work and overall work. Retirement, it does not matter when you earn your credits as long as you get to 40 credits, which most of us are going to have within 10 years of work. So you can earn 4 credits a year max. That's why it takes at least 10 years of work to get a retirement benefit. Then you must be at least 62 years of age or older. So for this year to earn 1 credit, you just need to make $1,510 of Social Security tax gross earnings. And the 4 credits you would have at $6,040. So for myself, I think I had my 40 credits actually by like age 26, maybe, because I worked in high school and paid in those minimum amounts and had those 40 credits at a fairly young age. So of course, most of us are paying more throughout our lifetime than that minimum amount that we need to get insured. Well, all of that is going toward figuring out our payment amount. So as long as you have the 40 credits, you get something, but then overall, how much you're paying into Social Security affects your payment amount. So the first thing we do to determine your benefits is we take your wages and adjust them for inflation. So we adjust them for wage levels over time. Then from there, we find the monthly average of your 35 highest years of earnings. So we do get some misconceptions on this. People think we might look at your most recent 5 or your most recent 10. It is actually your 35 highest years of earnings. And for some individuals, there'll be some 0 years in that equation. From there, we get your average index monthly earnings, and then we apply a formula to that average index monthly earnings. So one thing that people might contact Social Security about is you might call and say, please tell me when to take my Social Security benefit check. Well, at Social Security, we can't tell you when is best for you to start drawing. All we can do is really give you the monthly benefit amount that you're going to be eligible for. Your monthly benefit changes every month from age 62. That minimum age you need to be on up into your full retirement age. So every single month it's going to grow between 62, your full retirement age. This example, the full retirement age is 66. I'm going to show you in a moment that is going up. So you can see that difference is $750 to $1,000. It would have gone up monthly incrementally. And then between full retirement age and age 70, you earn delayed retirement credits. So at age 70 is where you no longer have it advantageous to wait. You would just be losing money after 70 by not taking Social Security. So full retirement age is when we consider your unreduced rate to be delayed retirement credits, full retirement age to age 70. So you see this example, it goes from full retirement age to age 70 up another $320 per month. So of course on paper, it always seems like, well, let me wait till I can get the highest amount of money. But there's a lot of other factors that go into these decisions. So something to consider might be your other income that you have, whether you're still working and enjoying work or physically able to work, whether you're ready to retire early and go ahead and start traveling or taking care of the grandkids or whatever your plan is. Maybe you have to work to Medicare age for health insurance. There's just so many factors that make your decision different than your neighbor's decision or your friend's decision. And then one other thing is people might consider is like the average longevity in their family. If everyone lives till 100, and people might want to prolong taking that benefit. And so they have that higher rate for a longer amount of time. Whereas others might say, well, the longevity isn't as long in my family, and I want to go ahead and take that benefit early and start enjoying it. And, even though you take it early and have that age-related reduction, you're going to have quite a bit of money collect between 62 and your full retirement age that you would miss out on by waiting. So again, it's a completely individual situation, and you have to kind of determine what's best for your situation. So here's where I was mentioning that full retirement age is increasing for people. So if you were born between 43 and 54, your full retirement age is still 66, but born 1955 and later, your full retirement age is increasing, going up 2 months every year of birth until we hit everyone born 1960 or later. So like for myself, my full retirement age is 67. So if I do decide to take it at age 62, I'm going to look at a 30% reduction. So at that point, I'll just have to see, how everything is going and if it's worth it to me to go ahead and take that reduced benefit, or if I want to hold off and let it grow. One big decision, though, is if you are still working prior to full retirement age, because we do have some earnings limitations that we have for individuals under their full retirement age. So these are 2022's figures. This is another thing that whenever we have a cost of living increase, these amounts will go up. So this year, the amount for working before your full retirement age that you can make and still receive all of your Social Security checks is $19,560 a year. After that, we hold $1 for every 2 that you go over that. So let's just kind of do an example of this situation. So let's say you had contacted us going into this year. You're over 62, but you're not full retirement age. And you told us, well, I think I want to draw my benefits with January this month, but I'm going to make $36,000 this year. And you're going to work throughout the year. So what we would do is we subtract the $19,560, and then we divide the remainder by 2 because we're holding $1 for every 2. So what I get when I do that is that you are $8,220 over the earnings limit with that $36,000 estimate. So what we're going to do is we're going to hold your monthly benefits up front in work suspense. So this means for you, let's say your monthly benefit, to make this easy, is $1,000 a month. We're going to hold 9 benefit checks in work suspense this year. So even though you said you want your benefits with January through September, you're going to be entitled but not paid those benefits because they're going to be held in work suspense. You're going to receive your first check with October, paid in November, because all Social Security checks run a month behind, and then you're going to get the 3 remaining benefit checks this year. Next year, if you're still under your full retirement age, we're going to start that scenario all over again. So if you do decide to do that, what happens at your full retirement age is that we're going to recalculate your benefits, taking into account those 9 months of work suspense. So basically almost like you took that benefit that much later, but you will receive that reduction at the January 2022 rate until full retirement age. So you might decide then, oh, maybe I'm not going to go ahead and file yet. I'm going to keep working and not draw my benefits. And getting 3 months of checks isn't worth it to me. That's fine. And then, like I said, if you did go ahead and draw it, we would recalculate your benefits at full retirement age. But let's say another scenario, you are going to work this year, you check in with us and you say, I'm going to work, but I'm stopping work in June. Well, then what you could do is, it does not matter. We have a separate test we can use. It does not matter how much you have made up until the point you stop working, if you are going to be under our second test, which is our monthly test. So that's just the yearly divided by 12. And I apologize, I don't have that figure on the screen here. So that is $1,630 a month. So you can make, let's say, $90,000 between January and June. And if you start your checks, you wait to start them till July when you're going to be done working, we can still pay you every single month for the rest of the year, even though you're way over that earnings limit. So again, there's a yearly test and a monthly test, and we have more information on this on socialsecurity.gov as well. Then you can see the same premise the year you turn your full retirement age, but you can earn significantly more at $51,960, and then we hold $1 every 3. So if you were turning your full retirement age and making that $36,000, you can start your checks in January this year and still receive all of them. Then the first day of the month in which you hit your full retirement age, you can work and make as much as you want and still receive all your Social Security checks. Now, in addition to benefits we can pay you as the retiree, We can also pay additional family members benefits at times. So benefits for children are, it does not matter if you have a parent who is on disability, retirement, or a parent who's passed away. The eligibility is the same. So a child must be unmarried, under the age of 18 or 18 to 19, and still a full-time student in high school. We can pay with that full-time student as long as you're considered to be through grade 12, and we have proof from the school that the student is still in full-time attendance. So it's relatively common to turn 18 while finishing high school, and we can continue to pay through then. We also have benefits for children that are disabled before age 22. So 18 or older, but disabled before age 22. So you might say be 40 years old when you go to, or your child, I'm sorry, might be 40 years old when you go to file for benefits. As long as they've had this disability since before age 22, and they are not married and have not worked substantially, they can still apply to get a disabled adult child benefit off of your record, even though they're older at this point, as long as the medical evidence is in file. Okay, so we're going to talk about spouses benefits next. But first, I want to talk about a policy change we had a few years back now in regards to deemed filing that basically just says if you were born January 2nd of 54 or later, so the majority of our retirees at this point that are coming to inquire about benefits, then if you have your 40 credits, you have to apply for any benefit you're eligible for your own record before looking at anything from the spouse. I'm really sorry about my puppy coworker here. This January weather in Illinois makes us all stir crazy, including my dog. Okay, so now that we've established deemed filing, basically know if you are born after that date and you have your 40 credits, we're always going to look at your own before we look at a spouse's benefit. So I'm going to assume deemed filing when we're discussing these benefits to spouses. So what we're going to do, we're going to look at 100% of your own benefit, unreduced. Even if you're age 62, we're looking at that full retirement age rate. We're going to look at 50% of a spouse's unreduced benefit, even if they filed early. If 100% of your own is more than 50% of your spouse's, we can only pay you your own benefit. Now, when you're currently married, you cannot receive a benefit as a spouse until your spouse collects. And you need to be at least 62 unless caring for a child of your spouse who is under 16 or disabled. So let's say that your own benefit is less than that 50%. So what we're going to do is we'll pay you what we can of your own. We're going to combine off the spouses. If you do not have 40 credits at all, of course, we're only going to look at that spouse's benefit. Then what we're going to do, we're going to apply that reduction for early retirement. So if you are under 62, or I'm sorry, under your full retirement age, it is not going to be the full 50%. Okay. Then for divorced spouse benefits, these also have deemed filing. You can only apply for benefits off a former spouse if the marriage lasted at least 10 years and you are currently unmarried. You must be at least age 62. Now, here is the big difference for divorced spouse benefits. Your ex-spouse does not need to be collecting a benefit yet, like they would if you were currently married. They just need to be at least age 62 and have their 40 credits, so eligible for Social Security retirement, or be on disability. So that's the big difference with divorced spouse benefits. Now, anytime we pay a benefit on a divorced spouse record, it does not reduce the payment of the worker, just like a spouse or children doesn't reduce the payment of the worker, but it also does not reduce the payments of any other spouse or children on the record. It's an independent benefit. Now, one thing I should mention too here is that spouses, divorced spouses, children, and survivors, which we're going to talk about, all have that same earnings limit that we talked about under retirees, that 19,560 for people under their full retirement age this year. And then survivors benefits. Again, the rules for children are the same: under 18, still in high school, or disabled before age 22. But for surviving spouses or surviving divorced spouses, things are a little different here, because you can get these benefits as early as age 60 or as early as age 50 if disabled, or again, any age if caring for a child under 16 or disabled. And another difference with survivors benefits is that you can remarry after 60 and not affect benefits. So on regular spouses benefits, if you're receiving off a former spouse and you remarry, that will stop entitlement to that benefit. But survivors benefits, the spouse who was married to the person when they passed away or a former spouse can remarry after age 60 and continue eligibility to the survivors benefit. And yet another difference with survivors benefits is we're looking at 100% of the survivors benefits. So at full retirement age, it's 100%, whereas the most you can ever get on a spousal benefit or divorced spouse benefit is 50%. At age 60, this is 71.5%. It goes up every month you wait between between age 60 and full retirement age. You can claim survivors benefits at any age between 60 and full retirement age. So we had a question in the chat before the presentation started about delayed retirement credits, basically on survivors benefits. So if the person that passed away was waiting until 70 to get their benefits and they pass away before drawing, the survivor can get the worker's delayed retirement credits. So we would be looking at that higher rate. The 100% of the full retirement age rate would be with those full delayed retirement credits. However, you cannot earn your own delayed retirement credits on a survivor's benefit. So you do not want to wait past full retirement age. So I hope that makes sense. So you're going to get the benefit of your spouse having waited. If they pass away before drawing, you'll get those delayed retirement credits, but you do not want to wait past full retirement age thinking they're going to go up because you're more than your full retirement age. So again, a summary here of spouse that's living benefits versus surviving spouse benefits. Spousal benefits at 62, survivors benefits age 60 or as early as 50 if disabled, 50% or less off someone who's living, 71.5 to 100% a benefit off someone who's passed away. And here is another thing that's different about survivor spouse benefits is it is an exception to deemed filing. So you do not have to take your own. You can just take the spouse's benefit and let your own grow. So a couple different strategies here with these spousal benefits. You can start on with the survivor's benefits. You can start on the survivor's benefit and you can switch to your own as early as age 62 if your own benefit's higher. Or you can continue to let your own grow. You can stay on the survivors all the way up till 70 and earn your delayed retirement credits on your own. Or you can take your retirement as early as age 62 and let the survivors grow up to full retirement age. But again, you don't want to wait past full retirement age on the survivor's benefit. So unlike the deemed filing provisions that we talked about with spouses, there are more options with survivor's benefits, no matter what year you were born, with the other provisions. Okay, so Medicare. Just to start to preface that Social Security only does enrollment in Part A and Part B. So as far as being able to answer questions about coverage or billing, all that sorts of things goes through Medicare directly. But I can tell you a little bit about the basics of Medicare as far as the different parts. So what we have is we've had Medicare Part A and Part B for many years. Medicare Part A is your hospital insurance. As long as you have 40 credits, there is no monthly premium to your hospital insurance. This is inpatient only coverage. Then Part B, the medical insurance, this is for doctor's visits, outpatient procedures, and certain medical supplies. This does have a base premium, $170.10 a month this year. I'm pretty sure I have a future slide that has it on it, but I'm getting used to the 2022 figures yet in my own head. So then back when I got hired, so about 17 years ago, was when we were really starting the Part D, which is the prescription drug plans. So you can have Part A and Part B, and you can add a Part D. This is done through Medicare or through the company itself, and that's your prescription drugs. In addition to this, you can also get what they call Medigap or supplemental insurance coverage. So if you see a letter over the letter D, EFG, any of those, that's a supplement to the Medicare. So Medicare Part B pays 80% of most things after the deductible is met. The supplement can help fill in those 20% gaps. Then sometime back also came along Part C, or a Medicare Advantage plan. And these are becoming increasingly popular. So in this, you still have your Part A and your Part B, but if you get into a Medicare Advantage plan, all your billing questions, all your coverage questions go through the Medicare Advantage plan provider. So this is going to be a private company that encompasses all aspects of your Medicare. Most plans include a Part D plan along with them. So the same company as your Medicare Advantage Part C. And then a lot of times they might have vision, hearing, and dental, which is not generally, most things aren't covered under traditional Medicare. So people do like the aspects of the Medicare Advantage plans and can offer some lower out-of-pocket costs potentially. But again, these are just the basics. We do not get into the specifics of these coverages at Social Security. Now, as far as when you're eligible for Social Security, we talked about disability a bit. So Social Security disability has Medicare entitlement after 24 months of entitlement to Social Security disability. SSI does not have any separate Medicare entitlement to it. And then age 65, that's the big time we're thinking about Medicare eligibility, the earliest you can get it based on age. Then we do have some specific categories for individuals with ALS, kidney failure, and not really anything we deal with commonly in Illinois, but some environmental health hazard exposure procedures. I haven't done any of that in my career, to be honest with the Medicare eligibility for that. So this slide covers Medicare enrollment based on that age 65 enrollment period. So the first opportunity is your initial enrollment period. This is the 3 months before your birthday, the month of, and the 3 months after your birthday. Now, if you're receiving Social Security prior to age 65, so you're taking your retirement early, you are going to be automatically enrolled in the Part A and the Part B. If you need both parts of that at age 65, great. That card comes 3 to 4 months before your birthday in the mail though, so just watch really carefully for it, because oftentimes it accidentally gets thrown away. So you're on benefits, you got your Medicare card, You then can go on to look into if you want Part C and Part D independently, you can do your research on that. But if you are not receiving a monthly benefit, there is nothing magical that happens at age 65 to put you into Medicare. So if you need Medicare at age 65, you need to do an application. If you need it the first day of the month in which you're 65, you need to get it done in the 3 months before. So if you are retired, you're likely going to need to get in during your initial enrollment period. So common situations that you're going to need to get in, even if you're not on benefits yet, if you're under a retiree insurance through work, if you're using coverage through the VA and you're at all thinking you're going to want any sort of Medicare, like using an outside hospital that the VA doesn't cover or something like that. If you are self-employed and you have your insurance through self-employment, or if you are under the marketplace, those are common times that you are going to probably want to get into Medicare at age 65. There probably is more, but that's just the most common. And however, if you are still working, so you're still working, you're covered under group health insurance based on your own, or your spouse is still working and they are covering you under their current work. And again, not self-employment insurance, not marketplace, but a group health plan. So for instance, I have Blue Cross Blue Shield through work. If I am still working at age 65, I would qualify for a special enrollment period down the road. It is any time after your initial enrollment period. So I will caution, if you're going to stop work within the 3 months after your 65th birthday, you need to be really careful because you can't choose your month inside your initial enrollment period. But once you get past your initial enrollment period, if you're working covered under that insurance, maybe you're working till 75 and covered under insurance, great. You do not have to take the Medicare, especially the Part B. If you were automatically enrolled in the coverage, you can, refuse the Part B if you want, as long as you meet the criteria. And we do recommend that you check with your benefit specialist through a work or your spouse's employment to confirm that they're not wanting you to take the Medicare at 65 for any reason. As long as they're not, great. There's just a couple forms we're going to need to get you into Medicare and not have any premiums with Part B. So when you're coming up on age 65, it feels like the whole world knows that you're turning 65 and you start getting all this junk mail, and some of it will talk about penalties. But as long as you have special enrollment period, you will not have to worry about those penalties. The penalties are for individuals who have to go through the general enrollment period. So let's say at age 65, you were just like, well, I'm never sick and I don't want to pay for that Part B premium. And we got the Part A done, but you said, I don't want that Part B. I don't want to pay the $170.10 a month because I never go to the doctor and I don't need that. Well, then that's the scenario that down the road, if you end up needing the Medicare coverage, you would have to wait for the general enrollment period. So right now it's January, we're in a general enrollment period. So general enrollment period is January through March of every year. The coverage does not begin until July of that year. So let's say you were in that scenario where you're that 75-year-old, you contact us, you say, oh, I'm starting to go to the doctor quite a bit. I need this coverage. So what you're going to have is you're going to get in, we'll get you the paperwork. We'll say, okay, you're going to start, you'll get your Medicare card for July of 2022. And you're going to have a 10% penalty onto your monthly premium for every year you did not take it. So that would be 100% penalty onto the monthly premium. You're paying twice the cost of that monthly coverage for the Part B. That penalty does last for the rest of your lifetime as well. So as I mentioned, your initial enrollment period, when you contact us, determines when your coverage starts. So if you contact us in the 3 months before your 65th birthday, it's going to start right the first day of the month in which you're 65. Even if your birthday is January 30th, it's going to start January 1st. If you wait till the month you reach 65, it goes to 1 month after. So if you contact us this month at 65, card starts with February. And if you wait after that, it goes anywhere from 2 to 3 months after enrollment. So if you need it right away, make sure you get it done in that 3 months before. The Medicare only application is available online. So say you just want the Part A, or maybe you just want A and B but not want benefits, you can easily complete that online. And then if you've taken just the Part A and you want to add that Part B during your special enrollment period, we now have several options to do that as well. We have the forms we need for the special enrollment period easily available in multiple sections of our website. You can see them linked here in the already enrolled in Medicare section. They're in our form section. The 40B is the one you complete saying, hey, I'm ready for my Medicare to start. The remarks, you put the month and year you want it to start. And then the L564, that's the one you or your spouse's employer has to complete, verifying that since the month you turn 65, you've had coverage through group health insurance every single month. Then you can either fax or mail them to your local Social Security office, or you can submit them online. You have a process to do that now as well. So here's where I can check my information. Yep, $170.10, I was correct, is the new 2022 standard premium. Some individuals do have to pay more than that $170.10 a month. If you are in that situation, you're going to receive a detailed letter letting you know how much you're paying in addition to the standard premium based on modify adjust gross income of 2 years ago. So we're using tax year 2020 at this time. If the situation applies to you, you'll also receive a letter explaining if you've had some sort of life-changing event, such as work stoppage, where we might be able to use a more recent tax year, and the letter lays out how to complete that process. As I mentioned, Medicare.gov is the resource for all things coverage, Part D, Part C, costs, procedures, all that sort of information is on the Medicare.gov website. You can also create a personalized My Medicare account that will help you look at all the details specific to your different plans and look at your deductibles, things like that. If the Medicare.gov website enrollment, Part C and Part D is all just a lot for you to handle on your own, which I think it is a lot to deal with. We have these wonderful counselors available all throughout Illinois, and every state has them, but I've worked a lot with the Illinois ones, SHIP counselors, and they can help you with picking these plans. So if you're overwhelmed by this process, I definitely recommend reaching out to a SHIP counselor. As far as applying for the benefits we talked about today, retirement, spouses, disability, Medicare, the easiest way to complete these applications is online. Survivors applications are not available online yet. So for that application, or if you are just not able to file online, that's fine. You can schedule an appointment if you call our toll-free 1-800 number, 1-800-772-1213. That number will offer you one of two things. They can set you up with an appointment where someone from your local office will call you, or depending on the type of application and availability, they might even switch you over to our claims taking unit to take care of your application right away. At this time, we still have limited in-person appointments for our offices, and it is by appointment only. So for certain critical services that cannot be handled over the phone or online, you can set up an appointment with your local office, but these are pretty limited to things such as original Social Security card applications, and certain situations where maybe there's going to be a loss of housing or things like that. If there's not an issue taken care of right away, our COVID-19 updates page lists these specific situations, but otherwise, say you just want to talk to someone at your local field office, we're still all available by phone. Our field office locator allows you to put your zip code in, and this will give you your local field office address, phone number, and fax number. So if you need to mail something, you want to fax something, you want to just talk to somebody during regular business hours, so Monday through Friday, 9 to 4, Except for federal holidays, someone from your local office is still available to answer your phone call. And this is what our socialsecurity.gov website generally looks like. So just make sure you're on socialsecurity.gov, make sure you're being safe. It's not socialsecurity.com. It's not a scam website. Look for our logo there in the corner. Generally, it has the, it'll have these panels, but they might rotate to look like something different. So this big panel is usually whatever our hot topic is. So when we release the cost of living increase, it was there. When we have COVID updates, it might be there. And then now right at the top, we have a different banners. We have our COVID-19 updates banner. We have a scam call banner. So it's really easy to use. Some other great features are frequently asked questions. So if you think of a question after we're done today, you can check out there to see if we've answered it there. And an easy link to our My Social Security accounts, our calculators, and then our menu tab has even more great information for different services and programs. Then, as I mentioned, we have a COVID-19's updates page. If you want to know whenever we change something, so you want to be updated as soon as we change what type of services we can provide in office, or we have any other changes related to that, you can subscribe to get an email every time we update a change on that page. And I've done that myself, and it's very handy to receive those updates. As I mentioned, we have those calculators you can reach from the main page, a lot of great planners on there. One thing I briefly addressed in the beginning is that some people do not pay into Social Security if they're a public school teacher or university, things like that. We have some calculators relating to benefits for those non-covered pensions. That's our WEP and our GPL calculators. We have a retirement estimator, which is now behind our My Social Security account, which is great. And just a lot of great variety of planning tools there. The retirement estimator has to be my favorite though, because it allows you to go in and provide what if scenarios. So say, I talked about how you cannot draw with us till 62, but maybe you work for somewhere that offers age 55 early out, and you go ahead and take that. So you want to know what would happen if you, to your benefit estimate, if you stop working at age 55, you can go ahead and plug those different scenarios into that retirement estimator. Okay, let's get to some of these questions at the end. So our My Social Security account, if you have not registered for a My Social Security account, I strongly recommend you get that taken care of. There's a lot of great reasons to get that taken care of. It's secure, it helps with your planning. It makes sure that no one else tries to go in and log into your account as you. And so I'll talk about a lot of the great features, but just to start off with, how do you get into a My Social Security account? We recently changed things with the My Social Security accounts. If you already had an account, so I had an account before September 18th of last year, I still go in, I put my username and my password in, sign into my account as usual. If you had never created an account, then we have a new way of doing this. So you can sign in with login.gov. This is our government access way of signing in. It is going to ask for personal information such as Social Security number, things like that. It is a secure website, so you need to complete that in order to create an account. If for some reason you create an account prior to September 18th, but you forgot about it, it will put you in an endless loop when you try to create one through login.gov. So if you get stuck in that loop, give us a call. We can check to see maybe you already had an account you forgot about. We can, send you information to reset that account the old way. But otherwise, you can sign in with login.gov, or you can use a partner account. You might already have one through our partner account, ID.me. If you have ID.me, then you can also, even if you have an account the old way, it'll let you log in through ID.me to socialsecurity.gov because it's an external site. So there's either of these options. In my experience, I have a login.gov already, so I wasn't able to recall how you create one of those accounts. As I said, I have to log in with my username and password since I had the account prior to September 18th, but I had never had an ID Me account. So when this option came up, I gave it a try so I knew what it would be like. It asked me to take a picture of the front of my driver's license, the back of my driver's license, and a selfie, and it confirmed my identity. I can't remember, there's a few more steps, and it set me up that way. So those are both options to get this account set up. And reasons why you'd want one of these accounts: if you do not have an account, you can do your retirement estimates, use possible spousal benefits, check your earnings once a year. That's something we really want you to do and make sure everything looks correct. And a big one right now, request a replacement Social Security card. If you have an Illinois driver's license or state ID and you're not correcting a name, date of birth, citizenship, something like that, you could usually get a replacement card online. And like I said, check those earnings records. If you've applied, you can check the status of an application or appeal. Once on benefits, you can opt out of mail notices if you prefer to just get them online. You can report wages if on disability or SSI and working. You can check out your benefit and payment information, change your address, phone number, direct deposit, all available online.
Megan, can you repeat that? You froze for like a minute there.
Yeah, I saw it said something about my internet account. So just on this page.
Yes.
Okay, so yeah, so you can, if you need that proof of income, that's a benefit verification. Some people call it an award letter. You can get that through your My Social Security account if you're on benefits. Change your address, phone number, direct deposit, Medicare card replacement. We're coming up on tax season. By the end of this month, the 1099s will be available there as a replacement. So a lot of great features. We have something now called advanced designation, which means if you might need a representative payee in the future, become unable to manage your money, you can tell us who your first choice at this time would be. We'll still develop to make sure they're a good candidate. Now, if you're not on benefits yet, your statement is available there and they are redesigned. It used to be white with green ink, and years ago we sent them out to everyone 25 or older. We now send them to 60 years of age or older, but you can get them at any age through the My Social Security account. And they've just made them more user-friendly, so I really like the way they look now. You can print these as a PDF from your account if you want to be able to, look at the hard copy, or you can save it to your computer if you're on your personal computer. It gives you a nice outline of at every age what your monthly benefit will be. It shows those most recent earnings so you can make sure everything's looking good there, and talks about disability and survivors estimates, all available on one sheet. And then we've added fact sheets. I really like these. They're supplemental for each age group. And like I talked about, if you have a non-covered pension, there's some in there for windfall elimination and government pension offset. There's information if you don't have your 40 credits yet, or for new workers, and Medicare fact sheet. So this is just an example of information for individuals 49 to 60 coming up on that retirement group. So those will be available in your account as well, or separately. You can find them on the socialsecurity.gov website. And just anytime we have an audience, we like to talk about phone scam awareness. So just know that Social Security, we're still having people call to impersonate us. We will never threaten you, say we'll suspend your Social Security number, demand immediate payment of you, ask you to pay us in gift cards, prepaid debit cards, or wire transfers. You might end up with an overpayment at some point from Social Security. You will get a letter from us with a legit way on how to pay it to an address that belongs to Social Security. So just be very careful of these. Help us spread awareness about these scam calls. Do not give up money or personal information. Be sure to hang up. So before you call anyone else, contact anyone about a scam call, terminate your connection to make sure they're not trying to listen in on future calls, and then report the scam if you have time to our oig.ssa.gov page. because they try to track these calls and track down these scammers that way. And we do have social media. So if you're on social media, we publish things on our social media accounts, like our scam awareness, like when our offices are closed for holidays, things like that. So we have Facebook, Twitter, Instagram, LinkedIn, and we have YouTube videos like how to create your My Social Security account and things like that as well. Okay, so I'm going to catch up on the chat here, and then I'm available for questions that I am able to answer. Okay, so I think the first one that I have not addressed yet, Letitia, when possible, can you elaborate on disability benefits? And if at any time, can you change your status from disability to being able to work? So yeah, so Social Security and SSI, the best way to start the process is online if you can. What if you do not have an excess of income or resources? I recommend just doing the application for Social Security disability online and then marking yes to SSI, and we can screen you for that program if you're not sure. And then it'll take you on from the application to fill in your medical information. And then someone from the local office reviews it and contacts you if we need anything else. If you cannot file online, you can do this whole process through a phone appointment. Either way, once we have things we need in place for your medical decision, we transfer it in Illinois to Springfield. That's where our disability determination service is. The adjudicator there is the one that actually makes the medical determination. So we determine your eligibility based on your work and your income and resources, things like that at Social Security office, and then they make the medical decision. Right now, those decisions are running anywhere from 3 to 6 months for a first decision. If denied, you want to file an appeal timely, and that takes another set of time period, 3 to 6 months. If approved, then you will be put into pay. And you have questions about being able to work. We have a lot of information about returning to work on our SSA work site on ssa.gov. Depending on which program you are on, Social Security or SSI, there are a lot of intricacies to work incentives. But just know we have a variety of work incentives that help you retain disability while returning to work until you're back on your feet with a job. So we have trial work period. We have extended period of eligibility. We have different work incentives. We have a ticket to work program that helps connect you with employers. That is all available. That's a whole separate presentation, to be honest with you, on the details of those. But ssa.gov, I think it's /work, or if you search the work site, we have a working while disabled publication as well. That's really good on information on that. Another question about what SHIP counselors can assist with. Now, I'm not a SHIP counselor, so I can answer to what I refer people there on, and that is Medicare Part C, Part D. They've even helped with the extra help for Part D. But with Social Security benefits, most of the time they'll refer you to the Social Security office if it's anything specific on your benefit with us. So it's more to do with the Medicare aspect a lot of times that they're helping on. I'm sure they can answer some questions about Social Security, but a lot of times they're going to work with the Social Security office on getting those questions answered. Karen, if you have questions about early retirement claiming, is it better to call the 800 number or your local office? The 800 number can provide benefit estimates and answer general questions. If you have a more intricate question you feel like, it might be better to contact the local office and they can pull up those estimates for you as well. But the 800 number can, answer a lot of questions and set up appointments for filing. Okay, if I retired at age 70 and my spouse earned under 40 credits, would I be entitled to 100% of my benefit and my spouse be entitled to 50% of my benefit? So, Arthur, you are going to have more than 100% of your benefit because you're going to have delayed retirement credits. A current spouse, so not a survivor's benefit, does not receive the delayed retirement credits. So your spouse is going to be at 50% or less if they are not their full retirement age. So again, remember, it's important what age your spouse is at as well. But you would get more than 100% of yours, and they would get 50% or less, 50% of your full retirement age rate if you, if they are their full retirement age. Now, survivors benefits, they do get the delayed retirement credit, so that's a little bit different. Okay, if you work in private industry and later work in public school, how does windfall provision apply? So, Brenda, as long as you have your 40 credits, you are going to always receive some sort of Social Security benefit. But windfall elimination is, again, it's kind of a topic I could not squeeze in under the presentation as far as a lot of details on it. If you have internet access, though, I encourage you to go to Securitygov, type in the windfall elimination provision. There's a wonderful publication, there's a calculator, there's a lot of information there. So basically, it depends on how many years of substantial earnings you have, how much your payment is going to be affected by that windfall elimination provision. Okay, Marjorie, I will turn 70 on February 28th of this year. When should I apply for max Social Security benefits? So your full retirement age is the first day of the month, or age 70 is the first day of the month in which you hit that age. So you can apply with February. I'm not sure, as McLean, about the Motley Fool article. That's not a Social Security publication, so I'm not sure what it's referring to on extra money. You know, the longer you wait, the more you can receive up until age 70, and that's kind of as far as extra money. What does Medicare Part A cover? For example, if you do not take Part B and are hospitalized, what will it cover? Again, that's a Medicare question, Joanne. So I do know it covers inpatient, but what specifically it covers inpatient, you can check the Medicare.gov website or talk to a SHIP counselor, because we do not get into the specifics of coverage at all with Medicare. Okay. I think I'm caught up on questions unless I missed one.
I think you have all of them. Yeah.
Okay.
Okay, any other questions? We'll give you guys maybe another minute if you have any further questions. And if anybody needs help finding a SHIP counselor, you can definitely call ElderWorks. I will put our phone number here in the chat, and we can provide that information if you have questions about Medicare. Okay, thank you, Megan, for a great presentation. I will be sending out these slides to everybody on Zoom here right now, so you guys can refer back to those for any websites or information on there. So, okay, I don't see any other questions. Okay, I think we'll leave it there for today. Everyone have a great day.
Thanks so much for having me.
Thank you.
Have a good day, everyone.